Perform hand hygiene. Verify correct patient using 2 identifiers. Place body in a private room if possible. If the patient has a roommate, explain situation to the roommate and move roommate to another location temporarily. Direct nursing assistant personnel to gather needed equipment and arrange items at bedside. Immediately after death and before proceeding with post-mortem care activities, place body in supine position and elevate head of bed 30 degrees to decrease livor mortis. Provide a peaceful presentation of the patient for individuals who desire an opportunity to grieve and view the patient. Assist family members in notifying others of the death. Notify the mortuary promptly, as chosen by the family, and discuss plans for post-mortem care. If patient has made tissue donation, consult institution policy for care of the body guidelines. Perform hand hygiene and don personal protective equipment, that is, clean gloves, gown, mask, and eye protection. Identify and tag the body, leaving identification on the body as directed by institution policy. Remove indwelling devices, for example, urinary catheter, endotracheal tube, if appropriate, as directed by institution policies and circumstances. Disconnect and cap off IV lines. Do not remove indwelling devices in cases of autopsy and follow institution policy for body preparation. Place dentures in mouth for viewing. If dentures do not stay securely in mouth, place in a labeled denture cup and transport with body to mortuary. If culturally appropriate, close the mouth with a rolled-up towel under the chin. Place small pillow under the head or position according to cultural preferences. Close eyes by gently pulling eyelids over eyes. Take note that some cultures prefer that eyes remain open. Shave male facial hair, unless prohibited by cultural practices or if the patient wore a beard. Wash soiled body parts. Be aware that some cultural practices require that family members cleanse the body. If family members are assisting in post-mortem care, have them don gowns and gloves as protection from body fluids. Place an absorbent pad under the buttocks. Remove soiled dressings and replace with clean dressings, using paper tape or circular gauze bandaging. Place a clean gown on the body. Brush and comb patient's hair. Remove clips, hairpins, or rubber bands. Remove personal protective equipment and perform hand hygiene. Identify the personal belongings that stay with the body and those to be given to the family. If family requests viewing, prepare the body and room in a culturally sensitive manner, according to institution policy. Place a clean sheet over the body up to the chin with arms outside covers, if desirable. Remove unneeded medical equipment from the room. Provide soft lighting and chairs for family. Provide a chair at bedside for family member who might collapse. Allow family time alone with the body. Encourage them to say goodbye with religious rituals and in a culturally expected manner. Do not rush any grieving process. Do not force family members to view the patient. Remain accessible to address needs and answer questions. After viewing, perform hand hygiene and apply clean gloves and gown. Check institution policy regarding need to secure hands and feet. Do not tie hands together on top of body. Use only circular gauze bandaging on body. Remove patient linens and gown per institution policy. Place body in shroud provided by the institution. Place an identification label on the outside of the shroud if required by institution policy. Follow institution policy for marking a body that poses an infectious risk to others. Discard used supplies, remove gloves, and perform hand hygiene. Arrange prompt transportation of the body to the mortuary. If a delay is anticipated in the transfer to mortuary care, transport body to the morgue. Provide significant others with the opportunity to express feelings. Document procedure in the patient's record.